Now we start scanning from epigastrium by using convex probe in transverse position. Here we see the echogenic lining. These are gases in the small intestines, and this condition is seen when there is obstruction somewhere in the gut and the normal small intestines are full with gases and distended and gives the echogenic lining in the small intestine. Now we continue scanning from epigastrium down to the pelvis. Here we see the free fluid containing debris in the pelvis. And continuous sliding down to the pelvis. Here we see the balloon of catheter in the urinary bladder. The urinary bladder is empty and no fluid seen around the balloon. Now continue sliding to the right iliac region. The distal ileum are also distended and full with gases. Here we see a free fluid in the right iliac region. But when we focus the small intestine, we see that the peristalsis is absent. Now we continue sliding to scan the ascending colon. Here we see the walls of ascending colons are thickened. These are gases in the ascending colon. Now we continue sliding to the hepatic flexor. Here we see the left lobe of liver and fluid around the left lobe. At hepatic flexor, the walls of ascending colon are also thickened. Now we will measure the thickness of ascending colon. The thickness of ascending colon is 45.7 millimeter. Now we will measure the wall thickness of ascending colon. The wall thickness of ascending colon is 25 millimeter. Now we continue scanning the transverse colon. The transverse colon is obscured by the excessive gases in the small intestines. Here we see the splenic flexor. Minimal fluid present in the splenic flexor of large intestine, but no fluid movement present. This is descending colon, which contain fluid and gas particles. Now, how we will write report?